in the history of Liaquat University, in the history of academics, of medicine, of sin. I don't think there has ever been a day when 400 plus students have produced new knowledge in the form of scientific research that is being published here. I mean, there have been times when the head of the states have visited this university. They have been sitting here, they have graced the, they were great days. But today is even greater than that when these children, these young people have produced research and made everybody, all of us, of course, especially the Vice Chancellor and the senior professors, but us also, anybody who's attached in any capacity to the Liaquat University is very proud of all these students who have done these things. And I am also grateful that I have been given the privilege of talking on the topic. So those students who are participating, I would like few minutes of your time. I would not take long time, but I would like you to concentrate completely to understand this thing, which is perhaps one of the most important concepts in medical research. So obviously it is not so easy, but I'll try to explain with examples so that when you leave your seats today, you will be much more knowledgeable than when you have come to attend this meeting. And it is the thinking. To you who think that they have done a small thing, I'm especially talking to the younger people. Those who think that they have done a small thing by producing a paper, by doing a research. I'll tell you a share, a couplet, कि जहाने ताज़ा की, सब जहाने ताज़ा की, अफ़कारे ताज़ा से है नमूद. It's your thinking. जहाने ताज़ा की अफ़कारे ताज़ा से है नमूद कि संगो खिश से होते नहीं जहाँ पैदा. These big buildings, these lights, all of these are very good. But it is your thinking, it's your actual research, it's your work that counts. And in Quran also Allah Ta'ala says, and I'll read the translation, that we will show them seekers. What are you? You are the seeker. Our science in the universe and in their own self, in your bodies, in your medicine, in your surgery, until it becomes manifest to them what is the truth. So even the Almighty wants you to do research and come out with the new ideas. Now, what is translational research? Translation, you all understand the meaning of translation. And that is what it means here. You know the basic sciences, you read anatomy, you read physiology, you read pathology, you read pharmacology, and that you do the research on the lab. Why do you do that research? Once you have completed your research, you come out with an idea, you come out with a conclusion, and then that conclusion is taken by the clinicians. And then they take it to the ward and see if it applies on the patients or not. If it is useful for the patients, it may come out as a form of a diagnostic test for the pathologists like your great Vice Chancellor, or like the great clinicians that are sitting here, in the form of drugs. So moving from the basic sciences, research on basic sciences, and translating it to the clinical science is what this it is. So in the next few minutes, I'll be taking you and talking more and more about it with the examples as well. But the bench, what is the bench? Bench is the research in the basic sciences. You go to the pathology, you cut the slide, it says you find out something, you publish your research. Many of you, I mean, there are thousands of people who are doing post-graduation here. And they are doing basic research. And the clinicians in the wards, they are translating it to the bedside. So while bench is the basic science research, The bedside is the clinical science research, applying the ideas that produced by the scientists of the basic sciences into the clinics. But it's not easy, it's time consuming. The average time from laboratory discovery, that is bench, to clinical application, that is bedside, exceeds 7.5 to 15 years. Some may be little quicker, some may take even longer, but it is 7.5 to 15 years. So my salute to all those scientists who work there and spend a large part of their life. 85% of biomedical research investment fail to deliver patient benefit within 20 years. Only 15% have any clinical benefit. And 1 in 5,000 compounds entering preclinical testing reaches FDA approval. Developing, that costs $1 to $2.5 billion. When a new medicine comes in the market, it's not cheap. It's time consuming as well as money consuming. So average is, I'm talking about average, there may be less or more, but it's $1 to $2.5 billion. There are 5 stages. If you are developing a drug, I'm sorry that some people can't see it, but even if you can see the top of it, you can see this is very important. I think every doctor and clinician and every medical student should know these stages, these 5 stages. First stage is the drug discovery. Even before they go to the laboratory and do the testings, there is a discovery of the drug. There is a hypothesis. There is a thinking, and they think that a drug can be developed. Once it's developed, then it goes to the bench. And preclinical studies which take 1 to 2 years. And in that study, it is found that they find about the drug. And it's done on animals and other things. Then the third step is the clinical trial. Clinical trial, I want you to remember one thing, that phase 0, phase 1, phase 2, phase 3 and phase 4 studies. Remember these things. Some people call it T0, T1, T2, T3, T4. Don't be confused, the same thing. So what is the T0? I'll come to it in a minute. But from T0 to T3 takes 4 to 7 years. And then they are submitted for the approval. Famously, in America, it is called FDA approval. That takes 1 to 2 years. And then there are post-market, they come into the market and doctors are told that, like some of the senior clinicians are sitting here, they are told if you find any side effect, any event with this medicine, please dial this number and report. And that's when it comes there. Preclinical phases में in vitro, so before anything, that is, then in vivo, which is the tissues, ex vivo, then they are